My name is Dr. Michael Baratz. I'm an orthopedic surgeon at Beth Deaconess Hospital in Milton, and I specialize in joint replacements of the hip and the knee, including revision surgery. So I grew up in Marblehead, Massachusetts, went to high school there, and then moved around a bit. I went to Northwestern University in Chicago, studied engineering, and then eventually went to medical school, ended up in Philadelphia at Thomas Jefferson University, made my way back to Boston and did the Harvard Combined Orthopedic Residency Program, and took my first job at Tufts Medical Center, where I spent 4 years before coming over to Beth Israel in Milton. Even as a little kid, I always liked to fix things. I liked to build things with blocks. When I went into medical school, I had a lot of interest, but what really interested me the most was sort of reconstruction of things, fixing a human body that needed to be fixed. So orthopedics was sort of a natural blend of those two worlds, of being of a carpenter and a physician at the same time. So the hip and the knee was appealing to me because I really loved the operations, but there's such a demand for it in this country, and you can really make an enormous impact on people's lives, because having a lower extremity that's not functioning properly really just takes you out of commission. You can't walk, you can't get to work, you can't get up and down the stairs. So the hip and the knee are both such important joints to replace that it just seemed like such a great field, a great career for me to pursue. So my first draw to BID-Milton was actually Dr. Dennis Burke. So Dr. Burke was a huge mentor to me in my training, and him and I kept our friendship and relationship up even after my training when I was working at another institution. And Dr. Burke, sort of near the end of his career, asked me to join him as his partner, and I just really couldn't think of a better person to work with. So that was the initial draw. He brought me to Milton for an interview, and I immediately fell in love with the place from top to bottom, from the leadership, nursing, therapy, really everything about this place screamed friendliness and a good place to work and continue my career. So, I decided to come here, and it's been nothing but positive. So my philosophy is that the decisions that are made should be shared decisions between patients and providers. So a patient comes into my office with a problem. Usually that's pain or a disability of some type. I like to present to them the options. Most of the conditions I treat are not life-threatening. They're really just life-limiting. And so going through the options, whether it be a conservative approach with pain medications, bracing, physical therapy, or eventually surgery, I really think it's them that should be choosing the option with my guidance.